And let's just go into the KUAM News Zoom room where we have the chairman from the Physicians Advisory Group, Dr. Hoa Nguyen, sitting by. Good morning, Doc.
Good morning, guys. Morning.
How was your
Feel
run?
like Monday.
Yeah, it does. It kind of
Yep.
feels like Monday. I know. It's the one thing about a middle of the week
The
holiday.
run was
Run was good.
yes. It's nice weather this morning. No raining, so it's good.
Right. Doc, so was there a meeting last night or
No,
no?
tonight.
Last night's Wednesday. No, this meeting will be tonight.
Okay, yeah. So what do you think is going to be discussed in tonight's Physicians Advisory Group meeting?
Uh, we got a lot of things to discuss. You know, um, we got to discuss about testing. Discuss about the quarantine facility, the isolation facility. So we have to quite a few things to kind of talk over with public health and try to move forward to make some change. But there's going to be some good discussion. Well, they are, they're changing. The biggest change we see and is wonderful is that there's a phone number now that you guys don't know for the isolation factor from 8 p.m. to 8 a.m. And I tried to call the other day, actually it worked. The people answer that, and so it will facilitate the patient who returned positive for COVID to have better access to the isolation facility to try to get away from their family,
Right.
to protect us. Also, hopefully, we're going to insert some education material there and for the people in ISO factor, so that way they can learn more about how to deal with the COVID-19 for the next 10 days so they go home.
Right.
So that's the key, is to get these people in the isolation factor and facility and basically teach them and also monitor them. So it's very good. You try to call and I call just to see if it's working. It's working. So I'm very happy with that.
Yeah, we actually put that number out. I think
Yeah.
Tuesday or whenever it came out.
Yeah.
But anything else? What about with quarantine? Are there going to be any changes or?
We have some new testing ability to test a lot faster now than before. So, we're gonna try to talk about testing arrival again, at the airport. We're gonna explore things to improve the process for return resident. The key here, try to get them home a bit earlier. But in a safe way, we have to either require the test before pre-arrival or test at the airport. Like I said, the testing platform changed a whole lot. So we're gonna try to use that for our advantage. So again, it's just an old discussion now, and we try to put that in motion once everyone has their own, say on it.
So
It's going.
just so I'm clear, you guys may be talking about tonight the possibility of early testing before you arrive and testing at the airport, and if you're negative, you would be able to home quarantine.
Sabrina have to be discussed by all the PAC and public health. So I wouldn't say that yet, but we're gonna explore several options to see if to move forward, because like I say, it's all depend on the testing platform, right? This thing change weekly or monthly as new things come out. Things that we used to wait, a day or 2 or 3, 4 days, now it can be 15, 20 minutes. So platform change and our thinking will change. So we have to explore those change for our advantage.
So, but that's an option that you guys plan to bring to the table tonight, at
Yes,
least to discuss. Okay.
Right on. Doc, are you guys good?
We have 15, 20 physicians along public health, people there. So we're gonna try discussing. So, like I said, when we update you as we have a consensus for everybody. So, okay, so, but we will move.
Right, but that's just for returning Guam residents.
Yes.
Doc, are you guys, so the outbreak of the Department of Corrections, they had 60 positive inmates and detainees, and an additional officer tested positive for coronavirus yesterday. When we talked to Director Carbolito the other day, he had said that the the isolation area at the prison can only accommodate 40 people. So are you guys aware of any discussions to either release maybe nonviolent offenders to home, whatever? I don't know. I mean, is there any talk about, do we have enough space to isolate all these positive cases at the prison? Or are we going to have to look at other options?
Well, I talked to
Jerry
yesterday.
Your public health have their own physician there, and also, the DOC had their own physician there, and public health on top of them already. So they will make a decision best they can, try to isolate. As you can see, when on the facility that's so closely, the people are so close together. The virus can spread pretty quick. It doesn't matter what do. So, but I'm glad that they jump on top right away. And a matter now of isolate this positive personnel, get them in a safe place so they won't spread to the rest of the DOC inmates.
Doc, can you provide us any update with Black construction?
Black have I'm telling you, Black have a very a robust kind of preventive stuff, but this kind of proves that the virus is so infectious. At first, Black will require only incoming H2 to be tested in the Philippines 3 days before they arrive, and then they quarantine them for 14 days by themselves, and then after 14 days they test them again to make sure they are negative. That's a stringent testing program that they do for their people. And again, it's all personnel. Their H2 are kind of stay within the compound, and they really cannot leave freely to go around. So once, let's say that the index person is a local person, local worker that live in the community, and I guess at the workplace somehow they spread to one of the H2, the worker that live in the compound. But so far, again, the latest number I have is 556, 312 positive, but they all are now isolated in the isolation facility that they created because they're a compound, and also the close contact is under quarantine at a different facility, and then the rest are negative. Non-close contact would be at the third facility. So they kind of separate them all three, and so far during the week, the past 2 days, we've been monitored. There's no other sick visit from the negative PCR test on the non-close contact. So
I'm sorry, Doc. I couldn't hear you. What was the number you said of positives?
So 556, 312 positive.
312 positive. Okay.
Yeah.
So it's still the same, I want to say.
That's crazy, Doc.
Yeah.
Any of them hospitalized?
Only one, but he's more stable now than before. So only one out that home batch is in the hospital.
Have you heard whether or not any other construction companies had any positive cases?
Public health working with some large company that have H2 worker and try to take extra step in order to prevent the similar situation. So I know they contact the major company already that have more than 500 H2. Then there's several that have that. So they are taking steps to try to prevent that.
What about Regeneron? Have you heard anything new with Regeneron?
Regeneron is IV infusion to be given to COVID positive, especially the high comorbidity patient ahead of time. It can given as an outpatient. So we just discussed it, and also we try to figure out, can we do that at the clinic level, at certain clinic. So those things it's not here yet. But once was here, and hopefully we have it soon, is that it can be given as an outpatient. Hopefully, again, the term COVID clinic are coming up. The question is where we're going to put it. So a lot of detail will be discussed. I think with public health, with the surgeon cell and the hospital, to see what is the best site to administer this IV infusion. But yeah, so we're gonna give it. CMS put out an article this morning regarding that. So hopefully we have it soon. You will hear probably the next 2 to 3 weeks if we receive it, and site have to stand up somewhere.
Okay, so that's the plan, that we want to open up the COVID clinic to do the Regeneron IV
infusion.
Right.
Yeah.
Okay.
Doc, what's up with all these positives lately? Which is like 100, 180, 122, so whatever. Jesus.
I mean, the positive case are up high, but if we're gonna try to break it down so public will know more about it. I think most of them is in clusters, just like DOC, just like Black. So there's they still have in the community, but those numbers does not reflect the severity that you can think. If those numbers are truly in the community, then you're in trouble. But I think the majority of this number is in a cluster that somewhat in the compound, just like DOC and Black. So it's not, the risk of spreading out to the community is very, very low. But those people are not going anywhere.
Yeah, but while we're testing these clusters, doesn't that mean that public health resources are concentrated on that, and that means that we're not testing in the community, or are they able to do both now?
Public health have increased the capacity for testing, so they can test 600-700 a day now. So the ability to test increase a whole bunch. So I don't think that they will run short in the testing supply, nor have problem keeping up testing. So their capacity increase quite a bit, most double, or they can run more than twice the number they used to.
So what do you think of this CAR score thing?
The CAR score thing is to make it simple, and Dr. Cabrera probably give a better description than I can.
He's coming on after you.
To kind of give a simple number, so our people in Guam can, based on that, to kind of shoot for the governor to kind of release more restriction and release them. So we all have to kind of work toward that low CAR score of 5 or less. From going to the holiday, like I say, we have Thanksgiving, you have Christmas, so we like to kind of put a target there and shoot for it, so that way we can have not normal, but somewhat less restriction toward the holiday. Again, that CAR score for our people want to shoot for, to try to abide by the social distance and the face mask and the hand washing, try to decrease the number in community. So again, the high number the past few days, if they really break it down, much better. You see that most of them is in the cluster. So we still have to do our own stuff on that. So we need the help for everyone in Guam. So if people don't gather so much, I know our culture, but it will help to go toward the Thanksgiving and the Christmas. As far as just like for example, for my clinic, for my practice, 3 locations, we used to get together with Thanksgiving for everyone at lunchtime. But this year we do something different. So we basically order a box for Thanksgiving. We pass it out. So to different locations rather than we gather together in one place. So we have to
Thanksgiving
do
is
something different.
in 2
that.
weeks, Doc. Thanksgiving in 2 weeks, right?
Yeah.
Yeah. So do you think we could get our car score down to is it 5 or 2.5 that we're
It's not. We can get down to 5 or below. Less than 2.5 is our goal. But for right now, because our car score is so high, shoot for 5, and I think we can do it. We just need everyone in the community to do that. So try not to get together the family so much. And we'd be okay. So again, we just ask everyone for their help. But that car score, I hope Dr. Pereira is on already. He can explain
He's
that
coming
a lot
on,
better.
yeah. It's pretty, yeah. I mean, you're saying it's simple, but it seems
It's
interesting.
complicated.
Yeah.
Some number you can shoot.
Is it simple or is it
It's-
complicated, Doc? All I know is since they came out with it, it keeps going up. That's all I know. It was
Yeah.
like 9.8, and then it was 20.
We're at like 33 something.
Now it's like 33.8, and
Again, that's the cluster, and if you truly understand that the number go up, reflect the cluster and not reflect the community spread. So I think it's interesting just to remove the cluster out once they sort out the number and recalculate the car score to truly see what the community car score is all about. So that is a screw one, just because it's the cluster and the DOC and with construction company. So, but hopefully we get there, guys. It's not that hard to get there if everyone help.
always the
Okay.
optimist, Doc. That's what I love about you. Always the optimist. Are you concerned at all? 20 in the ICU, Doc.
That's a big concern. I tell you, we can have a number down to 70 now, but there's a lot of ICU and a lot of people on the vent, and that's where our chance to lose our people is people in ICU and the vent. So I keep my finger crossed and pray that those people get off the ICU, get off the vent, but we will have a few more deaths before it's over with this episode. So. Yeah, our hospitalization now down to 70, so thank God it's like that. So it's hopefully moving the right direction.
Doc, this car score, is this something that the physicians advisory group said, hey, we got to do this? This is a great idea. People are going to really
we tried-
understand this.
What we have was come up with some different things than to get the restriction to be released, right? So, and we usually base on 4 different guidelines. So we try to come up with one that make it easier. It's not easier for people to see, but it's kind of little need little calculation in order to get there. So I think from my understanding, it's based on the number of positive per 100,000, the number of positivity rate, and also I think how to measure the spread in the community. And those 3 factors come into one number, and that's what Dr. Pereira was come up with. So again, I hope you come up and explain that more than just my simple term explanation. So
He's got
it's
charts
just
and everything,
one number.
Doc. He's got a whole bunch of charts. Dr. Cabrera and the
It
charts.
sounds I know. Oh, he liked this stuff. But
He went to where'd he go, Jay?
They went to Yale.
Yale. There you go. They teach you that.
Go
at Yale.
Bulldogs!
Well, he's
All right,
coming
Doc.
on, Doc.
Yeah.
So
okay.
It makes you pay attention, Doc. Okay, so next time we ask you about it, you'll be like, "Oh yeah, car score. It's easy. It's the daily new case rate per 1,000, check mark test positivity rate times the effective retransmission value." Duh.
Yeah, those are 3 factors. And hospitalization, I think less than decreased by 25%. That's one of the goal. So I think so far we dropped from in the 90 or 100 down to 70. So yeah, it's that's 25% almost. So
All right, Doc.
but again, everyone, just make sure that follow the 3W and really help us to get in that car score 5 or less, so we can have somewhat Thanksgiving or Christmas that near normal. Okay, so it's very good. So be safe, guys, and then just be careful. Okay.
Thanks, Doc.
Always, Doc. Be safe. You be safe, okay?
Okay, so strive for 5. Okay, so need to be less than 5.
Strive.
Okay, we have
4, 5.
Okay,
I'm in.
way
Come on.
to cheer up.
I'm all aboard, Doc. I'm really just want to kill this curve, not flatten it. I want to murder it.
Yes. And
Okay.
hopefully the vaccine
Don't
soon.
start with that
So,
vaccine stuff, Doc. People keep saying we're getting a
hopefully-
vaccine for Christmas, but when you read the news, it's like not going to happen. So it's easy on the vaccine talk around here.
Okay, but
You start
if you
talking
get
about
it, you
vaccine,
get
and
it.
people are going to go around touching everything. Oh, there's a vaccine coming out. It's false hope. I think we need to figure out this car score thing first.
Okay, so I make sure where will come up with
Am I
that to
going on?
you.
I'm just saying. I keep hearing this
Okay.
vaccine. You know what I mean, Doc? Okay. Because
Yes,
now I
I
just
do.
read that you need a special type of deep freezer to even get the vaccine. Like it's got to be kept at negative 1,000 degrees or something like that. That's an estimate, Dr. Cabrera. Okay. We'll see you.
Okay.
That's that.
You guys have a good day.
You too, Doc.
Be safe.
Make sure you check out our virtual. We have virtual Potu. Okay.
Ah!
Right on. A little bit of that sticky icky for you, Doc. Okay.
And Dr. Cabrera's waiting for that too.
Yep. Dr. Cabrera's like, oh, I'll take some Potu. That I could do.
Delivery, okay? Some real thing, okay?
Yep. Got it. Thank you, Doc. Okay. So
Bye.
deliver the real thing. 7:16. Guys, we got to take a real break, and then, all kidding aside, we're having fun with this car score thing. But it's going to be the way that we move forward into more freedoms, less restrictions. So we're going to go in with Adelou Press Secretary Crystal Paco San Augustine and Dr. Felix Cabrera